Thank you for joining me today for Medicare Crash Course number 2. Before I get into the details, I just want to say please like and subscribe, as well as if you have any specific questions, put a comment down below. I will reply to them personally. In this video, we are going to be going over Medicare supplements, as well as dental, vision, and hearing products. If you have not had a chance to watch the first video, I highly suggest you do so. In that video, we discussed what Medicare covers and what it does not. If you remember, I mentioned that Medicare is like Swiss cheese. There's holes throughout the entire system. You have two options to fill in those holes. Option 1 is a Medicare supplement, and pairing that with a prescription drug plan. Option 2 is a Medicare Advantage plan. So we're going to be talking about how to fill in those holes with Medicare supplements today. So what are Medicare supplements? Medicare supplements are extra insurance that you could buy through a private insurance company that will pick up the out-of-pocket expenses that Medicare leaves, i.e. filling in the holes as we describe it. Who designs Medicare supplements? Medicare supplements are designed by the federal government through the CMS. That means they are all standardized. So no matter what company you buy it from, the same plans have the same coverage across all companies. For example, we are going to be going over Plan G, Plan N, and Plan F, which we will touch base on. But the coverage of those plans, whether you buy them off Company A, Company B, Company C, they're all the same. What changes is the group you fall into and the price you pay. So what are your options for Medicare supplements? As you can see by this chart that I have pulled up, which is from Medicare.gov, you have Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, Plan K, Plan L, Plan M, and Plan N. So just to give you an example, these plans are all standardized, meaning no matter what company you buy it from, the coverage you see is the same across all companies. Now, for those of you that have been Medicare eligible or turned 65 from January 1st, 2020 or earlier, you can buy Plan F or Plan C. For those of you that are not Medicare eligible until January 1st, 2020 or later, you do not have the option to buy those. The three most common ones that we see at our office, and the ones that we are going to give you examples of today, are Plan F, Plan G, and Plan N. So we're first going to start with Plan F. Plan F is going to pick up 100% of your Medicare Part A deductible. It is also going to pick up 100% of your copay for your hospital stays from days 1 through 60 and 61 through 90. On top of that, if you remember, Medicare gives you an additional 60 reserve days. It will pick up the copay from that one as well. And it will also give you an additional 365 reserve days of hospital stay. So it bumps up how long you're eligible for those reserve days. As far as nursing home coverage goes, Plan F is going to cover days 21 through 100 at 100%. Still not going to cover from days 101 and on, because that is when it is long-term care. Plan F will cover the first 3 pints of blood that Medicare does not. It will also cover the copay for outpatient drugs and a patient respite care that Medicare would leave you for hospice. As far as your Part B expenses go, Plan F is going to pay your deductible 100%, and it is going to pay your 20% share at 100%. It'll also cover your excess charges if you are in a state that is allowed to bill excess charges. So long story short, with Plan F, the only thing you're worried about paying is the premium. Because for all Medicare eligible expenses, it's picking up the bill 100%. But remember, to be eligible for this, you have to have been Medicare eligible or turned 65 before the 1st of January of 2020. So if this is not an option for you, now we look towards Plan G. Plan G covers your Medicare Part A expenses the exact same way that Plan F does. There is no difference. It'll cover the hospital, the nursing home, the blood, and the hospice the exact same way. The difference comes in on Medicare Part B. With Plan G, you will pay your once per year $257 deductible. After that, you have 100% coverage because Plan G will pick up your 20% coinsurance. Plan G will also cover excess charges in the states where they are allowed to bill so. And then one more step back from Plan G is Plan N. Just like the previous two, Plan N is going to cover your medical expenses 100% for Part A. They are identical for all three. For the hospital, for the nursing home, for blood while you're in the hospital and hospice, all three plans are the exact same. With Plan N on Part B, you will pay your once per year $257 deductible. After that deductible is met, Plan N is going to leave you with two copays. They leave you with an up to $20 copay for any office visit and an up to $50 copay for any emergency room visit. So if it does not fall under either of those categories, it is 100% coverage after the deductible. So if you go see your primary doctor, you could get a bill for up to $20. Same with all specialists. If you go to the emergency room, you could get a bill for up to $50. But if you're getting things like chemo, dialysis, outpatient surgery, those are covered 100% because they do not fall under the category of office visit or emergency room. The only other thing that Plan N may leave you to pay is the excess charge. It does not cover that. However, again, if you reside in a state where they are not allowed to bill so, you're not worried about it. A couple things I want to note with Medicare supplements is there are two variations that you could actually opt into. And one of them is called a high deductible. And it's literally what it sounds like. You could opt into a version of, say, Plan F, where you have to meet a deductible before you receive the benefits of Plan F. These are generally offered at a cheaper price. And then there's what we call select Medicare supplements. So as you see, these plans are standardized. So I'm doubling back again. No matter what company you buy it from, it is the same coverage. But what changes between the three is how much you pay, and that is dependent on what plan you take, what company you're with, and over time, your rates are determined by how big the group is. Everything works off the law of large numbers here. The more people there are on a plan with a certain company, the more people there are paying premiums that are going to offset the expense that the insurance company has to pay. Also, what's changing between the three is how much you pay for the individual plans. Plan N naturally is going to be generally the cheapest amongst those three, with Plan G being in the middle and Plan F being the most expensive. Now, what do Medicare supplements not cover? Medicare supplements are not going to cover any expense that is not deemed Medicare eligible. So if Medicare denies a claim, the supplement's not going to pay on the claim. So I describe it as the supplements are just ball and chain to Medicare. They're following along. Medicare pays, supplement will pay. Medicare doesn't pay, supplement doesn't pay. If you remember, I said before there are 4 things that Medicare does not cover: routine dental, routine vision, routine hearing, as well as prescription medications. So you have to buy a policy to cover those. We will go over prescription medications in the next video, but for right now, I'm going to touch base on dental, vision, hearing. So if you're concerned with getting routine dental, routine vision, and hearing covered, you will probably have to buy a standalone dental, vision, hearing plan. These plans are offered through private insurance companies at a premium. And basically how they work is you may or may not have a waiting period. So you want to watch out for that. When shopping for dental plans especially, you want to make sure that you understand the waiting period. So what some policies will do is say, oh, we'll cover preventative care now, and we'll give you 20% or whatever percent on basic services. After a year, we'll bump that up. Some policies don't cover basic or major services till after a year or two. So you really got to watch for that. Some policies, depending on if you've had prior dental coverage, whether you're leaving an employer, they may waive the waiving period altogether. So those are just things to watch for. And then the vision and hearing, it's exactly what it sounds like. You buy a policy, sometimes they're all bundled, sometimes they're not. But you buy a policy that will give you coverage at a vision provider, as well as buy a policy that will give you coverage at a hearing provider for things like exams and hearing aids. Those are all completely dependent on what company you're looking at and what they have to offer. So make sure to refer to a local agent or someone who understands the business to be able to give you the best information possible for you. Well, and that concludes the video on crash course number 2, where we went over Medicare supplements as well as dental, vision, hearing products. I know I kept this very broad for the sake of the video, so if you have any specific questions, please comment them. Like I said earlier, I will reply to them personally. And if there's anything that you want to see in a future video or a specific topic that you think I could give you more information on, comment that as well. I'd be happy to take any suggestions you got because I want to give you the information that you want to hear. So again, please like and subscribe and make sure to stay tuned for Crash Course number 3, where we'll go over prescription drug plans. Thank you and have a wonderful day.